All right, everyone, let's cover breaking bad news in an OSCE exam. So it comes a lot in every OSCE exam. It can come as a face-to-face consultation. It can come as a telephone consultation. So whenever you need to break bad news, you can use that protocol spikes. Okay, let's go through it step by step. S for settings. Yeah. So what you need to know, you need to make sure that this setting is actually appropriate to break bad news. And if it's a face-to-face consultation, you wouldn't worry about that, because that will be already done for you by the exam situation. Yeah, so you'll have a quiet room, you will be you yourself, the patient, and the examiner. Yeah, but if it's a telephone consultation, you need to make sure this is the right settings for you to break the bad news. So you can ask the patient, Mr. Jack, is it the right time? Is it the right time to talk to you? Are you in a quiet place where we can talk privately? So you can give one warning shot like that, or making sure that this is the right time for you to talk to the patient. Because if you're going to break bad news to someone, you cannot talk to someone while he's in the metro, for example, or in the bathroom, or in a lecture, or in a class. So just ask, is it the right time to talk to you? Second step in every breaking bad news is P for perception. Perception is the checking prior knowledge. Okay, so you can ask the patient, what's your understanding of blah, 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 the illness or the symptoms that he had come with first time? Or how much do you know about your condition or what has happened? Yeah. So check prior knowledge of the problem. Yeah. Okay. And in this step, it is the history taking step. So you need to invest a bit more time here, because if you do not invest in this step, you would finish the station in 3 minutes and you would stay silent for the rest of the consultation. Yeah. So invested in taking some history. Yeah. Can you tell me, how have you been since you were last seen? What symptoms you came with first time? Are they getting better? Are they getting worse? So you can talk about symptoms depending on your task, or checking prior knowledge, what has been happening with you so far. Can you talk to me through what has happened? If you are talking to a relative, you can ask him about, how much did you know about your father's condition? What has happened with your father? Can you tell me more? Was he experiencing any symptoms before admission? What have you been told so far? So explore, have some professional curiosity. Okay, and in this step, as I mentioned, you invest in history taking. So first thing is the checking understanding or prior knowledge or perception. Second step, you can ask about any symptoms. If they have been some symptoms, check them, check if they are getting worse or better. And then the third step, as we do in any counseling history, we can check some risk factors or background information, like how was your father before admission? Was he having any medical problems at all? Social history, was he living by himself, or does he have any carers? How was his mobility if he came with a fall, for example? Yeah. So that will be perception, which is the history taking part. Checking understanding for prior knowledge. If there are symptoms, you can check symptoms and check how they have been since he or she was last seen. You can ask about psychosocial and general history for risk factors if it is deemed to be appropriate. Yeah. The third step, I, for invitation. You invite the patient or the relatives that what you are going to say is serious news or bad news. How can you say that? You can give a line like any of that. I'm afraid it looks more serious than we had hoped, Mr. Jack. Okay. Or you can say, I'm really sorry that I do not have good news for you today. So give a warning shot. This is the invitation. Okay. I'm afraid it looks more serious than we had hoped. You can use the best case scenario line or worst case scenario line if you're not quite sure. But if you have a definitive diagnosis, for example, patient was admitted, we have done a CT scan, there is a massive bleeding in the brain, then this is a massive bleeding in the brain. I'm afraid I do not have good news for you today. Your father was admitted, and then you go to the knowledge part. Yeah. So K for knowledge. What do you need to do here? You need to be honest, direct, and simple. Okay. So you can tell the patient here what has been found or what is in your task. So yes, your father was admitted in the last few days after he had a fall. We have done few investigations, including a CT scan of his head. I'm sorry to say that we have found out that he has a massive bleed in his brain. So you give the knowledge as clear as possible, and then you stop. Why do you stop? Because you need to see the reaction of the patient or the relative. You need for them some time to absorb the information and give your reaction. What will be the reaction? Silence first, and then the patient may start to be upset, sad, crying, overwhelmed. Let them vent first. After the event, you go for the letter E, which is empathy and sympathy. I'm really sorry I have to deliver such news to you. It must be very difficult for you. I can see that this is a lot for you to take it. Give one good line for sympathy and empathy. There is a lot of lines you can use. You can check my IPS session for that. And after embassy, the last step is summary, which is the planning ahead. So after you give sympathy and empathy to the patient, you can, or to the relative, you can offer water if you have water nearby you. You can offer tissue if it's nearby you and he's crying, for example. Yeah. And then you finish your station with the management, which is the summary or the plan. So to take things further, Mr. Jack, we will need to refer you to the cancer team. For example, if you're talking to a relative about someone who had a bleed, for example, so to take things further, the specialists have decided for a palliative treatment, and then you discuss what is palliative treatment. Yeah, everything will be mentioned in your task. So you can talk palliative treatment is supporting care to improve the quality of life, but we're not planning to do anything aggressive or anything invasive, so we do not cause any discomfort to Mr. Smith or Mr. Jackie. Okay, and you can indeed arrange a follow-up if you have any worries or any concerns. Please come back to us. We'll be happy to rediscuss. We can give a leaflet about the problem as well. So overall, the basic line. This can come as breaking bad news with a patient or breaking bad news to someone relative to the patient. In both ways, you do settings. Setting in a telephone consultation is to make sure this is the right time or right place to talk to the patient. Yeah. Perception to the patient or to the relative, you check prior knowledge and you explore that. Be curious to know more. And then you check for any symptoms. And if there are symptoms, you explore if they are getting better or worse. You can complete some history as well by taking some social history, like with whom your father lives with. Is he independent? Does he live by himself? Some social history will be helpful in your management here. And then invitation, one good line as a warning shot, I'm afraid I do not have good news for you today. Or I'm afraid it looks more serious than we had hoped for. Okay. And then give the knowledge, clear cut knowledge, very simple, very direct. I'm sorry to say that it shows that you have breast cancer or a lung cancer. Wait for the patient to vent some silence, and then the patient will give you a reaction or emotion or an emotion, and then you give sympathy and empathy to that, and then you summary and you plan forward. Yeah. How do you plan forward? You will have that written in your task. For example, surgery planned or palliative chemotherapy or palliative plan, or nothing will be done, blah, blah, blah. So you check that and you answer any questions from the patient side. This is how to do any breaking bad news. Okay, so before I finish, a quick announcement. As usual, we have a mind maps package for every case in a mind map, as you can see in my playlist, and we have all breaking bad news scenarios or possible breaking bad news stations that you may have in clinical practice, and we have a mind map for them similar to the one before. You are very welcome to join if you like, and if you like to join, you can text me on WhatsApp on that number or Telegram on that number as well, or you can join my groups, as you can see them in the description. At the end of the day, I wish for you all the best, and you deserve 12 out of 12. Thank you.